Hello, everyone. Um, so so it's a little bit rainy here, so if you can hear the rain in the background, trying to do it in between the rain. So my name is Sarah Ogden. I'm assuming you can see my PowerPoint that I've made. So we are doing functional anatomy and we have to do a project on a video analysis. And so the movement that I've chosen to analyze will be running with a focus on the biomechanical implications of the common injury that I've chosen, which in relation to running, I've chosen the runner's knee as an injury to go with this one. So they just go hand in hand. So I just trying to figure out this. Yep. So I've chosen running because it's not only a foundational movement in sport and exercise, but it also presents clear, observable phases of motion that allow for detailed mechanical analysis. So within this video, we had to choose a video, choose 5 different frames from the videos. So I've chosen to go with sagittal and frontal perspectives. Um, so yeah, the 5 frames that I will be analyzing are drawn from the sagittal and frontal perspectives because this way we can understand both movement patterns and alignment related issues. So the frames that I have chosen to go with, first one focuses on the initial contact that the runner has on the ground. Second one is the mid stance of the runner. Third one is the toe off, so the toe coming off the ground. And then the 2 frontal views. I've also chosen a mid stance view of the runner, and the last frontal view will be of the pre swing. So these frames highlight the repetitive forces and mechanics that contribute to patellofemoral stress. So, I'll do the next one. Yeah, so that's a description of the frames that I'm going to incorporate into this assignment and this video analysis. So moving on. So before we dive into the movement analysis, I just want to focus a little bit on quickly focus on some key directional terminology and planes of motion. So I've got directional terminology and planes of motion. So directional terminology, so when we say flexion, we're referring to the bending of a joint. So whereas extension is the opposite, where the so flexion as an example is like when the knee or hip bends during the mid stance, whereas extension is the opposite, a straightening of a movement, like during the toe off, where the knee or hip straightens. So, moving on to the planes. In the frontal plane, so we look at adduction and abduction. Just going to go back to that while we look at adduction and adduction. So these movements are movements that either move away from the midline of the body or towards the midline of the body. So, like example, if you have your hands by your side and then you lift up laterally, you are bringing that away from the midline of your body. So adduction, abduction, and then if you bring it back towards the midline of your body, that's adduction. So this is important when we see knee valgus, which is the inward knee collapse. So there's just a few examples of different terminology. And then So we also need to look at the body segments. We also need to define our body segments. So the foot and ankle, especially in terms of dorsiflexion and plantarflexion, and the knee joint, both tibiofemoral and patellofemoral, the hip joint, which governs stride and pelvic control, the pelvis itself, which may drop if the hip muscles are weak, and we have the trunk, particularly any lean or compensation, and also the arms, which help to maintain balance. So, understanding these terms allows us to describe motion accurately and assess how they change in the presence of injury. So there's the three planes of motion. So you have the sagittal view, which divides the left and the right of the body, which associates flexion and extension. The frontal plane, which divides the front and the back, so adduction and abduction. And then you also have the transverse plane, which divides top and bottom, which involves rotation of the body. So moving on to the frames that I have chosen, I have got a screen capture of the runner in the video at the frame that I've chosen to analyze, as well as a timestamp as when that screen capture was taken. So here is the initial contact. So this is when the heel strikes the ground while the knee is flexed at about 20 degrees. So the hip is also at slight flexion and the ankle is dorsiflexed. So this is the preparatory phase. Sorry, I'm not very good at saying that word. So this is where the runner braces for the ground reaction forces. And if you look at it from a biomechanical role, this perspective, so this phase is about the shock absorption of landing on the ground. So any weakness or stiffness here can shift more load to the knee. And moving on to the second frame. So this is also in the sagittal view. I've chosen the mid stance, so at 15 seconds into the video, and you can see in the screen capture that I have on there on the screen where she's in the mid stance. So as we move on to this one, the knee bends further, as you can see, so around 45 degrees, allowing the body to move and accept weight. So the ankle transitions towards plantar flexion while the hip remains flexed. The pelvis also appears to be stable and the trunk is upright. This is the most load-bearing part of the gait cycle. The knee must manage high forces. If patellar alignment is off, stress increases here. So you really want to make sure everything is aligned in your stance. And we want to move on to the third frame. So I've chosen the toe off position in the sagittal view as well. This is our last one for the sagittal view, and then we have two more for the frontal view. So this one's at 25 seconds into the video. And so at toe takeoff, like at the toe off position, you can see that there's a triple extension pattern. So simultaneously, there is the hip extends, the knee extends, and the ankle plantar flexes, all to push off the ground. So the arms counter rotate for balance as well. And this phase is so crucial for propulsion off the ground. So as soon, like when your foot is trying to propel you forward, through your running. This is the stage where that occurs. So if you also bring runner's knee into this frame, so the pain might reduce the push-off force or cause the runner to permanently shift weight, leading to imbalances. So let's just say, for example, you have runner's knee in one of your knees. You will then compensate on your other side to push off harder, whereas one side is not pushing off as hard. So you will then, if you do this over and over and over again, you will create imbalances from your left side to your right side of your body. This is why we also focus on, in the gym, you want to focus on unilateral exercises so that you can balance out both sides of your body and strengthen both sides of your body so that you're not imbalanced and one side is stronger than the other, because you want to be equally powerful on both sides of your body as much as you possibly can. You don't want to have one side weaker than the other, especially if you're running, because that is just a recipe for disaster, basically. So moving on to frame 4. So we now move on to the frontal view, which is also a mid-stance view that I've chosen, but you just get to see a different angle of it. So the frontal view, I've picked this at 7 seconds into the video, and you can see there her position. So from this frontal view, you can notice a mild valgus alignment. So basically, this just means that her knee is collapsing inwards. And there's also a hip drop on the opposite side. So this suggests that the glute medius weakness is on the stance leg. So it's suggesting that she has a weakness in one side. And so this is commonly seen in people with runner's knee and is referred to as a positive Trendelenburg syndrome. Sorry, I'm not very good at saying that word. So the consequence is that the knee shifts medially, so it comes into the body. So this increases the patellofemoral joint stress simply because of poor alignment. And so this is a great example of how proximal muscle weakness, so as we spoke in this case, would be the hip, can lead to distal joint dysfunction. Yeah, so back to the point of her having a weakness on one side, especially in her hips. Moving on to frame 5. So I've chosen the pre-swing in the frontal view. So it's 18 seconds into the video, as you can see there in the image. So in the pre-swing, so just before the foot leaves the ground, you can further see the foot pronation and a slight trunk lean towards the stance leg. And the patella is slightly medially displaced. And the body is shifting weight in preparation for the next stride. And this frame reveals compensation. So compensation to one side of her body. When the body tries to minimize pain or stability, basically, it can adopt insufficient patterns like excessive pronation or trunk lean, which unfortunately may increase the risk of injury elsewhere. So because she leans to one side and favors one side, she could develop injuries either in her ankles or her hips or even her lower back because she's compensating. So those are the 5 frames that I've chosen to analyze, and we're just going to move on to a little bit of anatomy, etiology, and pathology to do with runner's knee. So basically, we want to look at how do these movements and the biomechanical faults we've identified affect performance and injury risk. And runner's knee, or also known as patellofemoral pain syndrome, is often described as an overuse injury. but it's more accurate to think of it as a movement quality injury. So poor control at the hip, knee, or foot over thousands of steps can lead to cumulative stress on the patella. So if you're going to be working your knees over and over and over again, especially if you're a runner or you work at a high activity job, you're going to be putting more stress on your knee joints. So when we break this down, so when the knee moves into valgus during mid stance, so as I showed in frame 4, this shifts the patella laterally and increases contact pressure on the lateral patellofemoral cartilage. The hip drop and the trunk lean further reduce the alignment between the femur and the patella. So this contributes to what we call maltracking. So, just going to check what the next slide is. Yeah, so some different information there. So during toe off, pain in the patella stress, obtained from the patella stress, may lead the runner to reduce knee extension or ankle plantar flexion, which lowers propulsion efficiency. So you're not going to be able to propel yourself off the ground as strongly as you should be able to. And this can really result in shorter strides, a slower pace while you're running, or overcompensation through the opposite leg or spine. So you're really trying to focus on one side because the other side can't keep up and isn't strong enough, basically. So move on to the functional repercussions. There is so many ways that runner's knee, or even just any injury to do with your knee, can result in functional repercussions. So you can have pain climbing upstairs or squatting down, which can contribute to everyday life problems such as being able to play with your kids, getting up and down from the ground, or pulling yourself off the couch or off the toilet. Just simple things like that can contribute to everyday life pain, basically. So you can also experience discomfort after long runs or prolonged sitting. You can get that aching feeling. You can reduce running endurance or confidence. So if you have trouble with your running, your strides are shorter, it's going to make your running harder. Like you will have to work harder than you should be, and will also reduce your confidence as well. So we just want to do a little comparison of the frontal and sagittal views of the different views that you can see in the video. So the sagittal view shows us the joint angles and power production. So just like I said with the triple extension during the takeoff with the hip, knee, and ankles, whereas the frontal view highlights the alignment issue. So like the valgus or hip instability. So if you have the frontal view, you can see if your knees are aligned. You can see if one person is really favoring one side, not the other. So both of these perspectives gives us a complete picture of what's going wrong and what needs to be fixed in rehab or training. Especially, this is extremely important for runners because you cannot be staying in that position for a long period of time without fixing the issue and doing what's right for your body, because you'll just be putting more stress on your body, basically. Like runners who take thousands of steps per day, even if it's a small biomechanical issue that exists, it can be repeated hundreds of thousands of times over a training cycle. So you don't want to be doing that to your body, to your knees, because long term that's going to have very negative effects. So in conclusion, so like we want to wrap this up. So, running is a complex multi-joint activity that places repeated loads on the lower body, so especially on the knee. So, through this analysis, we broke down 5 key frames of the gait cycle. We identified directional movements like hip flexion, dorsiflexion, and valgus. We saw how improper mechanics can increase patellofemoral stress, as well as connected those faults directly to runner's knee as an injury, also known as patellofemoral pain syndrome. And we also dove into how the injury can affect everyday movements like stairs and sitting and etc., how it reduces running performance and efficiency, and how it can be observed clearly in both frontal and sagittal views. So, overall, what we want to take away from this is using anatomical and biomechanical analysis gives us powerful tools to prevent injury, basically. So, it improves performance, and you can design better rehab strategies to better your life in the long term, basically. So, next time you see someone running, or if you're running yourself, like think beyond just the surface level of putting one step in front of the other. Like, look at how someone moves their body and how that movement reflects their strength, their control, or any dysfunction that they might be displaying. I also have a page just with a few references of where I got my information from for the PowerPoint. I'll just leave them up there for a second. But all in all, that is my video for the video analysis of the 5 frames of different movements and functional anatomy to do with running and runner's knee. So thank you very much for listening.